Hello and welcome to CoreNet Online 2022, where we discuss learnings on resilience and resurgence from 2 years of COVID-19 in India. In today's session on health systems resilience, we will hear stories, experiences and challenges from a range of stakeholders in the country's primary healthcare ecosystem. World over, the World Health Organization's 6 building blocks have been acknowledged and used for thinking through an effective and balanced healthcare system. These 6 building blocks signify the importance of a sound healthcare system and ensure its well-functioning and efficient service provision to meet the health needs of people across the globe. However, the pandemic brought to light key challenges and in some cases deepened the fault lines in India's health system. Having said that, there have also been certain bright spots and learning opportunities that have paved the way for the future of a resilient health system. Dr. Angela Chaudhary is a director at Swasti, an organization dedicated to innovating solutions for transformative health impact. She explains how the pandemic brought together a diverse range of individuals from various sectors for the greater good.
There's a renewed understanding of what is public health and what public health can do, and therefore everyone jumped into the hat. Earlier it was just limited to clinicians and social workers, but really public health had a way of unifying. The COVID pandemic had a way of unifying what would be redefined as public health, and it included epidemiologists, researchers, academia, scientists, private sector players, small clinics, diagnosticians. A lot of digital startups got into the game as well and supported people. Philanthropists, those who hadn't added health or public health or population health on the mandates added that, private foundations, and lots of unlikely partners, which is great.
Primary healthcare is a whole-of-society approach to health and well-being that is centered on the needs and preferences of individuals, families, and communities. It focuses on the comprehensive and interconnected aspects of physical, mental, and social health and well-being, as well as the broader determinants of health. Primary healthcare includes 3 components: meeting people's health needs, systematically addressing the broader determinants of health, and empowering individuals, families, and communities to optimize their health. A strong primary healthcare system is essential towards not only achieving Sustainable Development Goal 3, but also several other SDGs that rely upon a healthy society and environment. Unfortunately though, primary healthcare services in India face several challenges, which were further exacerbated by the COVID-19 pandemic. It negatively impacted day-to-day healthcare services, especially those that impacted women, children, and other vulnerable groups. While the healthcare system was struggling in trying to contain the spread of the virus, ASHA workers were on the front line, risking their lives to protect those of others. To dive deeper into challenges faced by primary healthcare workers, we spoke with Ms. Bhanupriya Rao from BehanBox, a bottom-up evidence-based journalism and storytelling platform, and with Sunita ji, an ASHA worker from the Sonipat district of Haryana.
The whole hierarchy of in the healthcare system, you see that during the pandemic, you couldn't have done without this category of workers. And yet, when it came to the responses of the state, they were really at the lowest end, as they always have been at the lowest end of the hierarchy. So, or lowest end of even states' care and rights.
Healthcare workers were the lifeline of rural communities during the pandemic. And even after delivering first contact healthcare in this period, they struggled to gain recognition or even fair remuneration. Let's hear from Sunita ji.
तो एक आशा को कम से कम 8 से 10 घंटे घर से बाहर रहना पड़ता है। फिर जितना हमें इंसेंटिव इसका मिलना चाहिए वो इंसेंटिव नहीं मिलता है। प्लस में जो हम इधर उधर बाहर आते जाते हैं, घूमते हैं, उसके लिए टीएडीए भी कोई प्रावधान सरकार ने नहीं किया है। 2 से 3 दिन भी कई बार हमारे खर्च हो जाते हैं, उससे हमारे दूसरे काम प्रभावित होते हैं। फिर परिवारों में समस्याएं खड़ी होती हैं। भाई वो सबको रोटी की जरूरत है और परिवार तो महिलाओं के बिना चलते नहीं। अनेकों तरह से हम प्रताड़ित होते हैं।
This has been a real challenge. India's health system was stretched to the breaking point many times during the pandemic, with the bulk of the care burden on ASHA workers.
In Karnataka, there were many cases. They documented about 100 such cases. In Haryana, these two states were particularly, disturbing accounts of violence. In spite of government invoking the Epidemics Act that violence will not be tolerated against healthcare workers, but there was really no redressal mechanism for them. So all in all, it was an exploitative system for ASHA workers, turned even more exploitative. So many ASHA workers we talked to, they said that we are made to feel like we are not even part of the healthcare system, like we are not part of the health departments. So you keep talking about corona warriors, and those days people were banging thalis and honoring the healthcare workers. So if you keep talking about corona warriors and you do not even pay attention to, so are we not corona warriors? So are we not important enough? And that means that these ASHA workers, very sadly but also very annoyingly, really are treated, and in their own words, are treated as worms. This is not something that I'm making up. This is exactly the term used by one ASHA worker from Andhra Pradesh, who I will never forget, who had a little quake in her voice when she told me, we are considered as worms by the system.
Underpaid, overworked, and overburdened, ASHA workers fighting COVID-19 in rural India were thoroughly overlooked. The pandemic not only increased the workload of the average ASHA worker while stretching their finances, but the difficult working conditions exacerbated work-life imbalance, leaving them in the middle of an unfolding mental health doom.
तो कभी भी जो है उस तरीके से सपोर्टिव सिस्टम हमारे लिए अभी तक तो क्रिएट हुआ नहीं है। देखिए, उस वक्त में असल में सरकार को भी हमें सपोर्ट करना चाहिए था। हमें जो है इस बीमारी से निपटने के लिए फुल ट्रेनिंग देनी चाहिए थी, सारी सुविधाएं उपलब्ध करवानी चाहिए थी, और जो हमारा दायरा है काम का, जिस खतरे में हम रहते हैं, उस पे हमारी सामाजिक सुरक्षा और हमारे पीछे हमारे परिवारों का क्या होगा, जितना काम का बर्डन है, जितने सफर में हम रहते हैं, जितनी मानसिक दबाव हमारे ऊपर है, तो उससे हमारी कोई सुरक्षा नहीं है। उतना कोई वेतन जो है सरकार उसके रूप बदले में हमें नहीं दे रही है, और जिस तरीके से शोषण कर रही है उस तरीके से जो है हमारे साथ केवल शोषण ही हुआ है।
Challenges raised by Bhanupriya and Sunita ji clearly demonstrate stress and burnout that frontline workers have experienced. While they made significant contributions to the state's response to the COVID-19 crisis with limited resources, they were not afforded basic human rights or access to physical and mental health services.
Hopefully there will be a change, is really the emotional and mental health support. That not just for frontline workers, but also clinicians. There's a huge stigma about doctors wanting and getting mental health. That's actually an issue that I would like to really focus on destigmatizing mental health services, particularly all across healthcare workers. So a big thing moving forward would be about destigmatizing mental health and mental health requirements. Two is about increasing the access in terms of having more trained human resources, but also opening out avenues for lay people providing counseling services, leadership with empathy. So there's a lot of space to be worked on.
Even as the challenges kept on accruing for both the system and the workers, it cannot be contested that the ASHA workers were on the front lines, leading the charge of tracking, tracing, and isolating on the ground. There were also many others who saw this as an opportunity to quickly offer innovative and affordable solutions. While the scope of digitization remains deep across the globe, the solutions for developing countries require a reimagination that relies upon localized and indigenous knowledge, given the vast diversity and complexity of developing nations. The primary healthcare innovations stem across four main areas: system-level determinants, public health center components, services, and outcomes. To dive deeper into the healthcare-related innovations and digitization in the pandemic years, we spoke with Mr. Sanjiv Chhabria from StepOne, a non-profit startup that augments government resources with technology, people, and processes to effectively fight against COVID. He spoke to us about what innovation means and how one would explain it in the context of a country like India.
One is the cool, sexy innovation in terms of, drones and the new technology and all of that stuff, right? That's innovative, right? And there's the other innovation, which is not rocket science. Like what we've done is not rocket science, right? We've taken a telephony app, we've taken a CRM app, we've plugged them in together, and we've brought people together saying how to use that, right? Now that is innovation, in my opinion, in terms of being able to solve a very, very complex problem with not necessarily too complicated technical details, right? We need to be able to be flexible and we need to be able to be scaled. So these were the three factors, I think, that played a role in our innovation. Our entire belief system is we're going to get some things right, we're going to get some things wrong, and it's okay to fail, but let's just keep trying because, the need of the hour is that we've got to deliver something, right? So if we don't get it right, it's okay, we'll iterate and we'll fix things.
To better understand innovation in the healthcare space during a pandemic, we also spoke to Ms. Neetha Joy from ACT Grants, a non-profit coalition created by the Indian startup system to fight the pandemic and drive change. Taking on a funder lens, she threw light on the need for quick responses, ensuring last-mile service delivery and benefits of a volunteer-run organization during the times of crisis.
In terms of challenges, I would say responding to the urgency of the situation was of paramount importance to us. We had to ensure that our deployments reached the end beneficiary on time. And this meant that we had to accelerate a lot of the normal processes and checks and balances that were involved in a typical equipment donation or like a relief activity. And then another challenge was really to ensure that our allocations were equitable and fair. Really, collecting data, working on, calling hospitals, calling district administration, really trying to understand a sense of what's happening on the ground, working very closely with NGOs who, kept us very aware and abreast of the situation on the ground. And also, we ensured that our allocation was as data-driven as possible.
Both Sanjiv and Neetha emphasize the importance of developing relationships with the government, non-profit organizations, the private sector, and the general public in order to achieve scale and disseminate innovative healthcare products and services. Each of these stakeholders has a role to play in the ecosystem, but it is also necessary to ensure that their roles and resources are optimized and effective.
So first is telemedicine works, right? Second thing is, I don't always need a doctor to be able to care for a patient. There is some amount of caring that can be done by a non-doctor as long as that there is a doctor supervising and guiding those people, right? Monitoring is something that can be done by the patient, can be done by the family. There is a component of patient education which becomes a very, very important aspect of care. Third is that our existing healthcare infrastructure, albeit overburdened or whatever, can be augmented. It's this confluence of the private sector, the government, individual citizens, and I think NGOs as well. Bringing all of these people together yields phenomenal outcomes.
We need to work very closely with the government and really dovetail our initiatives to what government is doing to really, help our initiative achieve scale. So that's been, part of our playbook going forward. And also during this process, we've managed to forge multiple relations with many NGOs who are focused in healthcare. So those also are quite valuable for us as we foray into broader healthcare even beyond COVID from here.
If we look at the response of the stakeholders during the pandemic, there are several case studies from which lessons can be drawn to strengthen and inform future service delivery and healthcare interventions. Here are the top 6 takeaways from research and evidence gathered across various case studies. What is essential, however, is that each stakeholder in the ecosystem recognizes their responsibility and works towards adaptable solutions that promise timely and relevant services to ensure equity and last-mile reach.